My name is Sarah Weeks, and today I want you to consider if quality of life is more important than quantity of life. I'm going to be talking about why physician-assisted death should be legalized in all 50 states. Physician-assisted death is when a physician provides, at the patient's request, a prescription for a lethal dose of medication that the patient self-administers by ingestion at the time that they choose with the intention of ending their life. It can also be referred to as physician-assisted suicide, medical aid in dying, but there's a couple different terms that people use, but physician-assisted death is the most appropriate term, and a lot of the laws refer to it as death with dignity. There's some misconception between physician-assisted death versus euthanasia. A lot of people think that it's the same thing, but in physician-assisted death, this entails making lethal means available to the patient that they use at their time of their choosing, whereas euthanasia would entail the physician taking an active role in carrying out the patient's request, such as administering lethal medication through an IV or through a feeding tube. So these are two totally different things. These are what current laws look like now in the United States. Those states in blue are states that currently have a death with dignity statute. They include California, Colorado, District of Columbia, Hawaii, Maine, New Jersey, New Mexico, Oregon, Vermont, and Washington. And you can see there's a couple different names that they use as far as those acts go. Light blue here, right as of right now, is only Montana. They have death with dignity statutes, but it's only legal by court decision. These light pink states are considering death with dignity this year, and then these red states are the most important for us to focus on because these are states that have no legislative activity this year as far as death with dignity laws go. So who qualifies to take part in death with dignity laws? Well, first off, you have to be an adult resident of a state where such a law is in effect. You have to be mentally competent, capable of making and communicating your healthcare decisions. You have to be diagnosed with a terminal illness that will lead to death within 6 months, and this has to be confirmed by 2 physicians. This is very similar to hospice, and another fact that a lot of people don't know about death with dignity laws. They think that you can just choose to partake in these laws because you want to die or because you're depressed about your illness to the point where you don't want to pursue treatment. But you have to have a life expectancy of 6 months, and this is confirmed by 2 physicians along with being confirmed that it's a terminal illness. Also tying in with being mentally competent, you have to be capable of self-administering the medications without any assistance. I want to touch base on the importance of terminology within physician-assisted death. So we know a lot of cultures, religions, personal beliefs view the act of suicide to be selfish, inhumane, or morally wrong. There's a lot of negative emotions tied into suicide. So a lot of organizations and people who engage in these laws actually find the term suicide as being discourteous and insulting. And this is because when an individual chooses to commit suicide, they're actively choosing death over life. Where these individuals, they're not choosing death over life, they're already going to die. Their death is imminent. They just want the ability to choose how they die and when they die. They want that patient autonomy, which I will focus on now. One of the biggest positive impacts these laws have is the personal autonomy and positive coping that comes from it. So patient autonomy refers to the right of patients to make their own medical decisions and decide what medical treatment they want to pursue and what medical treatment they want to receive. These laws give individuals opportunities to manage goodbyes with their loved ones. They're able to make peace with their fate. They're more open to talking about their diagnosis and their feelings towards it. Another big portion of these laws to focus on is a psychiatric evaluation. And when talking about this, I'm going to be referencing specifically the Oregon Death with Dignity Act and the statutes that are listed. Oregon was actually the first state to legalize physician-assisted death all the way back in 1998. So one of the statutes, the counseling referral, it states, no medication to end a patient's life in a humane and dignified manner shall be prescribed until the person performing the counseling determines that the patient is not suffering from a psychiatric or psychological disorder or depression causing impaired judgment. It also further goes on to specify what counseling means. It has to be a state licensed psychiatrist or psychologist. It also further goes on to specify what capable means, where the patient has to have the ability to make and communicate healthcare decisions to healthcare providers. So this is a really important topic to talk about with Death with Dignity Acts, because a lot of people don't know these psychiatric evaluations are required. Another huge positive impact of these laws: we're able to avoid prolonged suffering and traumatic death for patients. Patients with terminal illnesses are likely to endure a great amount of pain and suffering, not only physically but mentally. For the example here, I'm going to use high-grade glioma. Patients with high-grade glioma suffer from cognitive impairment symptoms such as memory loss, confusion, personality change. They also suffer from seizures, muscle weakness, balance problems, changes in sensation. These laws promise a peaceful death while the patient is still competent, especially if a patient has something like high-grade glioma. In later stages of this disease, the cognitive impairment symptoms get worse and worse. So with physician-assisted death, a patient is able to die before they get past the point of not being alert or oriented to their situation at all. So to give you a glimpse into what it's like from a patient's perspective and their feelings towards it, I'm going to play a really short clip of Brittany Maynard, and her husband will be talking in the beginning of the clip. She was diagnosed with a brain tumor and chose to partake in a Death with Dignity law. She actually became a huge advocate for this law. This just gives you a little glimpse into what it looks like from the patient's perspective.
Between suffering or being allowed to decide when enough is enough, it just, to me, makes provides a lot of relief and comfort that, okay, that option is there if and when we decide, or she decides that it's time.
I can't even tell you the amount of relief that it provides me to know that I don't have to die the way that it's been described to me that my brain tumor would take me on its own.
So just a little glimpse of that. These laws also have a huge effect on loved ones. They don't have to anticipate the state of which their loved one will eventually be in. Caregiver and financial burden can also be greatly reduced. So if a patient is receptive of what is to come and can positively express their thoughts and feelings about their diagnosis, then individuals with relation to the patient have a better chance at feeling the same way. And the result of this is positive coping for the patient and the loved ones. There's also healthcare benefits. Healthcare costs can be greatly reduced within the hospital. Organs can be donated before they're damaged and unusable from terminal illnesses. When a patient goes to hospice, they can be there for months, and by the time that they die, their organs are not viable for transplant anymore. There can also be more focus in the hospital for caring for acutely ill patients, as opposed to focusing on intensive prolonged treatment for terminally ill patients. Some opposing arguments I want to bring up. Biggest one, it's a violation of the Hippocratic Oath. People like to say that doctors take an oath to do no harm to a patient, and prescribing lethal medication, which in return kills the patient, is doing harm to the patient. But promoting a comfortable death and eliminating prolonged suffering should be viewed as doing no harm to a patient. And this oath should be interpreted and modified as necessary according to an individual patient's needs. A lot of people also like to say that we already have hospice and palliative care programs, so why do we need this option? But the 2019 statistics from Oregon show that 90% of patients who opted for physician-assisted death were actually already on hospice, so this suggests that hospice and palliative care aren't always sufficient to treat severe suffering. And I also want to point out that in the last couple weeks when someone's in hospice, most of the time to speed up the death process, while usually they make sure the patient is in no pain, but to speed up the process, they won't give the patient any water or food anymore. Whereas someone who decides to take part in death with dignity laws, they're able to live their life as normal as possible and do the normal things they're used to right up until they decide to die. So in conclusion, quality of life is far more important than quantity of life, and every and any person deserves the right to avoid prolonged suffering and have complete control over how they die. And if people had a more extensive understanding of the eligibility standards for these laws, the process that the individual and the physician have to go through, and the positive effects that these laws have on patients and their families, then this would greatly influence personal stances on physician-assisted death. All in all, physician-assisted death should be legalized in all 50 states. And these are my references. Thank you so much for watching.